Australian Public Health Association is very similar to Abrasco. We have members from many different areas, from academia, from the health services, private, smaller organisations as well. And so we are similar in terms of our membership, and we're also similar in terms of some of the work that we do. So we are very strong policy advocates for the government in the areas such as human rights, in social determinants of health, climate change and health, as well as specific areas of health, nutrition, physical activity, health promotion and so on. So the Public Health Association in many ways is similar to Abrasco. Abrasco is more perhaps rights focused, so rights and health is a much stronger theme for Abrasco, and we would really like to learn from Abrasco about that, because while it is there as one of our areas of focus, it's not as strongly embedded in our programs as it is here in Brazil. So we can learn from Abrasco that way. Well, we don't have partnerships yet, but that is one of the reasons why I am here to talk to Abrasco about developing partnerships. And I've had meetings over the previous 2 days with Abrasco members to talk about joint initiatives, and particularly internationally. We are both members of the World Federation of Public Health Associations, and we were discussing yesterday about issues that we will take to the World Federation next May at their annual meeting, where all of the member states get together. And we identified a number of areas that Brazil and Australia will work together to advance some issues to the World Federation. We are a very important actor. The Public Health Association has worked very strongly to develop a working relationship with government. So we are still independent, we do not have government money, we can still criticise government, and they know that, but they also invite us onto important committees. So either myself or key people in the association or our Chief Executive Officer will actually be on key policy decision-making committees, and in some cases chairing those committees, because they value the independent public health role of our association. Australia has a universal health system, so everyone in Australia above a certain level of income will pay a percentage of tax, and that goes directly to health services. So we have a national health insurance system. The government pays private doctors to see everyone. So they will claim money back from the government. So many doctors, what we call bulk bill, they don't charge their patients at all, they will charge the government. Some doctors charge a little bit more than the flat rate, in which case the patients will pay the difference, or their insurance system can pay the difference, because some people have private health insurance on top of the public system. So everyone is covered by the public system, but some people will have private health insurance as well. So it's a very good system. It covers everyone, everyone is involved. It is supported very strongly by government. We also now have, in addition, a dental health insurance system and also a disability national system. So we are very strong at the baseline. Unfortunately, our health status is similar to other Western countries. So we have high rates of overweight and obesity, so high rates of diabetes and chronic illness. The alcohol issue is a big one in Australia, so we have quite a few problems associated with drinking too much alcohol. So it's similar in many ways to Western countries, but we don't have the same extent of poverty issues as you do here in Australia. So the specific undernutrition or hunger, we have some, but not to the extent as Brazil. Most people are very proud of the system. There are a few people who say it doesn't take, it doesn't happen quickly enough for them, or they have to wait and so on. But most people are very supportive of Medicare is what we call it, and we have had it in place for 25 years, almost 30 years actually, and it is still going very strong. Some of our conservative governments have put more support into the private health system rather than the public health system, but our Public Health Association has been very actively resisting that and putting pressure on government not to do that.